Did you know that opioid deaths in Australia have doubled in the last decade? And prescription opioids contribute to 2 deaths and 75 hospitalisations every day? These harms are not just from taking too much. They can happen to patients who take their medicine as prescribed. Patients who are most at risk are those who are prescribed high-dose opioids, those who also take other sedatives, or those who have comorbidities. Even in the most careful patients, unexpected factors like changes in health can increase their risk of severe side effects, which is sometimes called an overdose. Naloxone is a life-saving medicine that can reverse the effects of opioids in an emergency while waiting for an ambulance. New formulations, such as the intranasal spray, make it easier for patients to use. Any pharmacy can stock naloxone and any pharmacist can supply it without a prescription. Are you unsure of how to start a conversation about naloxone? Research shows that most people taking prescribed opioids would appreciate or expect to be offered naloxone. As a pharmacist, you're in a position to make sure this happens. You can also empower patients with an opioid safety plan, give them tools to respond to a severe reaction, and maybe even save a life. When starting a conversation about naloxone, reassure patients that supplying it is something you discuss with everyone as part of your duties as a pharmacist. Can I talk to you about a medicine called naloxone? It is available over the counter, and we recommend that anyone taking strong opioids keeps it in the home. We know that language is really important when discussing opioid-related risks. The term overdose means different things to different people. Some patients may think you are talking about illicit drug use or suicide. To avoid stigma and miscommunication, we recommend using words such as severe side effects instead of overdose, but you can choose a term that makes sense to you and your patient. Whatever word you use, make sure you define what it means first. You could say something like, the most severe side effects from using opioids are loss of consciousness and difficulty breathing, which, in a worst-case scenario, can cause death. This is sometimes called an overdose, but it can happen even if you take your normal prescribed dose. Many patients have heard in the media that opioids can cause harm, and patients are often relieved to know that they can do something in case of an emergency. You can reduce stigma by normalising naloxone. Keeping naloxone is like having a fire extinguisher, first aid kit or EpiPen. We hope you'll never need it, but it's important to have in your home just in case. You can reassure them that this is just a precaution and that it applies to everyone. Now that you're talking about naloxone, what should the conversation cover? To prepare. Help your patients to prepare a safety plan. You can use the Maximising Opioid Safety leaflet as a guide and advise the patient to discuss this plan with family, friends, or a carer when they get home. To prevent, as with all medicines, it's good practice to discuss how to reduce risks. To respond, educate the patient on the signs and symptoms to look out for and explain how to use naloxone. Encourage them to discuss these with their family, friends, or carer. It's easy to administer. It's just 1 spray or 1 injection, and you can check the product for more details. Taking just 5 minutes to discuss naloxone empowers your patients with a safety plan in case of emergency. You might also save someone's life.